they even had one where the entity just refused to even talk to them. You know, you're not the boss of me, I guess is what they said. But I fought the law and the...
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
Welcome to episode 446 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle of Carden. What's happening, Donna?
You know, I'm feeling that hamster on a wheel thing today. You know, just running just as hard as I can and doesn't seem to be moving forward.
Yeah, you'll have that from time to time.
Yeah. Yep, it's today. There's just too many things happening around me.
So as we are recording this, it is the day after Super Bowl. What do you think about it?
I thought it was a great game. I mean, you know, I hate the games that are not, you know, they're just big blowouts and there's no surprise endings, or, you know, the game's over before you get to the fourth quarter, which, you know, some people prefer that so they can get to bed, but and everybody also has the Super Bowl flu. Super Bowl flu hits a lot of people, I think. But I loved how it went into overtime, and I even said that I thought this game was going to get down to the wire just like the one in, I guess, 2000, I want to say, when it was here in Atlanta, and it was St. Louis and Tennessee. And I think it ended with the ball being like inches from the goal line by Tennessee to, you know, it was like right there at the end. So, yeah, everybody was like, oh, this is going to be a really offensive game. It was a battle. So,
yeah, it was. I remember it was before the first quarter was up, and I said that I thought that whoever won was going to end up pulling it out in the last 2 minutes of the game. I wasn't far off from the truth.
You just didn't know it was going to be overtime.
Yeah, last 2 minutes overtime.
Got tied up, and then it got tense, man. But the whole game was tense. It was never, you know, a big, clear difference between the teams. So, you know, congratulations to the KC, you know, folks, and you know, the Midwest, they like to have their sports heroes up there. Yeah. So, back to the normal work.
Yeah. So today we're going to be talking about an insider breach, because those do happen. And it did cost somebody dearly.
Yeah.
Ooh. Man.
Yeah. Well, it is one of our top 5 threats.
Yes, it is.
So,
but you know, as you've mentioned before, Sally been here for 20 years and she would never do something like that.
I know, right? There's no way. We don't have to worry about that with our staff. Yeah. I'm like, do you know what's really happening in everybody's life?
Yeah.
I'm going to go with no.
Yeah. You know, maybe you don't have to worry about that with your staff, but you should worry about that with your staff.
Yeah. Yeah.
So we'll cover that, because there was an OCR settlement in regards to that, and it was a whopper. So we'll look at that. But before we do, we want to say thanks to those who subscribe, and be sure to share us out and leave us a review. That's the only way we get paid. Just a simple click of a button. Give us a review. We'd much appreciate it.
Spread the word. That's what we need.
That's right.
If you have subscribers, then the algorithm rewards you.
That's right. And if you want to be rewarded even more, you can show up at the HIPAA boot camp, or otherwise, as we call it nowadays, the HIPAA Privacy and Security Boot Camp, because it has gotten massive.
Yeah.
3.5 day in-person event, April 9, 10, 11, and 12.
Yeah. You know, we started at 2 days. Then we said we can't do it in 2 days. We're going to have to go to 3. And we tried to do it in 2.5 days or 3. Now it's 3.5. And between the adding in the CPGs and the NPRMs that are rolling out, we know those more are coming. We're going to have to go to 4 full days, which this is where if I were saying this in front of my team, they would all kind of freak out. So I'm only going to say it on the podcast so I know when they listen to it, I'll hear about it. Just so that everybody knows, my team listens to these podcasts for their training. They learn things in these podcasts. So just a hint for you to encourage people in your neck of the woods that, are remotely interested. They should be listening. They're getting training. I'm just saying.
Yeah. And to be fair, your team isn't necessarily learning things they want to learn sometimes, like the fact that you're extending the boot camp.
Yeah.
Yeah. That'll be fun. But if you're interested in knowing more, you can go to prisecbootcamp.com or thehipaabootcamp.com to learn more, because time's running out. We ain't got a few more weeks left.
For the early bird, yeah.
Yeah. Oh, for the whole thing. I mean, April. Be here before you know it.
I know, right? Oh, man, how time flies when you're not having fun. Yuck, 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 yuck. Speaking of not having fun, let's talk about people not having fun.
Yeah. All right. Let's go to the HIPAA Say What?
Say
because, there is some indication that the HIPAA audits might be coming back.
Yeah. Yeah. For those who always ask about, I'm getting audited or you being audited or anybody's being audited, that they haven't done audits since 2016 and 2017. That's when they did the test audits of the audit program. No other audits have been done since then.
That's why none of my clients have ever failed an audit.
Not a single one. But, the investigations and those kind of things that happen, those happen pretty constant. There's a flow of those. In fact, every time you see a data breach over 500, you're going to get an investigation. But there's a lot of investigations that aren't even on that page. So that is the case. In the Federal Register, they released a notice that OCR is doing some data collection, and they have, ironically, it's part of the transparency that everything's documented out in the Federal Register. The problem is, if you go to read the Federal Register, you can't understand it unless you have an idea of what you're looking at, which it even took me a minute. I'm like, what is it telling me? But anyway, they have published that they are sending out an online survey of 39 questions, so not too onerous, that will be sent to 207 covered entities and business associates that participated in the 2016-2017 OCR HIPAA audits. That's exactly how many audits have been done. 207. So that is, there's no pass or fail of the audit. It's, we may start an investigation if your audit results are not very good. But this survey will gather information relating to the effect of the audits on the audited entities and the entities' opinions about the audit process, which is like, it's like just standing up and saying, throw darts at me.
Yeah. Well, what gets me is that I wonder how many of the people that went through the audit are even still working at those entities. I mean, you're talking, 7, 8 years ago? I mean, turnover happens quite frequently. So it's going to be interesting to see what type of responses they get. Is it going to be a lot of, they don't work here anymore, or we weren't part of that, so we don't really know? I don't know. It's going to be interesting.
Well, that just shows you nothing has been done with audits since they published that report. Period. Yeah. It's clear. Mm-hmm. Because OCR is conducting a review of the audits to determine its efficacy in assessing the HIPAA compliance efforts of covered entities.
Yeah, I'm glad I didn't say business associates.
Yeah, well, anytime they say covered entities, it also means business associates.
But yeah, it depends on if it's capital C covered entities or lowercase c covered entities?
Yeah, they get into all that legal stuff. But the other line says, measure the effect of the audits on covered entities and business associates' subsequent actions to comply with the HIPAA rules. So what they're wanting to know is, was it really hard to do? And as a result of doing this, did you improve your program? And there's some other questions they're saying, but those are the two big ones. But that just tells us, I mean, we've heard zero mention of it. And remember, we have the plan is to ramp up enforcement activity because of the amount of data breaches that are occurring and questionable controls in place to prevent them or prepare for them.
Right.
So
I think OCR should just put out a free audit. Would you like to get a free audit? Fill out this form.
I remember though, they did a webinar and you went through the webinar and it explained. And the good news is some people were given privacy rule audits and others were given security rule audits. And, depending on what your audits were what you were picked for was what you had to supply. And even then, it wasn't about the entire rule. It was about very specific elements of the rule. So the bigger issue will likely be, as you mentioned, nobody remembers.
I mean, even if I was the one that was part of the audit, I mean, you asked me what happened 6 or 7, 8 years ago. All I remember was just horrifying. That's all I remember.
Can you do 6, 7, 8 hours ago? I mean,
no, not really.
Yeah,
No, not really at all. So yeah, it's one of those things where you're giving me more work to do, therefore it's not good. Anytime, even when I get like an insurance audit, you get those like once a year. We're doing an insurance audit. I'm like, I get livid. You are just kicking in my door, put stuff on my desk, and I'm paying you to give me more work to do. Something wrong with this.
And people just doing their job. People just doing their job.
Do it somewhere else.
Yeah. It's like the ones that all, get all mad at me because of what I'm telling them. I'm like, it's not me. It's cyber criminals. It's internal criminals. It's, nosy people and rules, because this is some of the most private information we should know. And it's not me. It's not me. I am not personally the reason for this conversation, and it will do you no good to attack me, because I'm just like, it ain't me. I'm not going to take this personal, but you clearly are.
There's a reason why they have the saying of don't shoot the messenger. That's all I'm saying.
Yeah, that's right. So,
but you did just mention, people inside your organization doing crazy things. And so let's shift to the craziness that cost a massive $4.75 million.
Ouch.
Mm.
Yeah. Ouch. That'll leave a mark.
Yeah. And of course, this is a voluntary resolution agreement, right?
Well, the resolution, this is not a civil money penalty. If it's a revolution, here we go. Talking about a revolution. Hey. The civil money penalties are few and far between. Mm-hmm. They have existed, but we try to explain this periodically. The civil money penalties are the ones where everybody yells 1.5 million all the time, which we point out is irrelevant. But there are cases where they have gone to civil money penalty for whatever reason. They even had one where the entity just refused to even talk to them. you're not the boss of me, I guess is what they said. But I fought the law and the anyway, those are the civil money penalties that get into play. And the ones that are the resolution agreements are the ones where it's like, okay, I'm going to promise that I'll do what you ask, and you just, a much lower amount. So if it was reduced amount for the resolution agreement, what would the civil money penalty be?
Ooh.
I don't even want to know. That must be why it happened. And this is the first one announced of 2024. However, the date on it is November 16th, 2023, when it was signed.
Are we holding on to these things?
Well, see, here's the thing. Let's look at what had happened was. I mean, yes, 4.75 million is, as a point of reference, add up all of the settlements that were announced in 2023, because now we're just going to focus on when was it announced, not entered into, because we can't otherwise. All the ones announced in 2023 add up to less than 4.75 million. Say for 2022, and you got to go back to 2021 to where it was just below 6 million before you get to anything that is remotely this big for the entire year.
Wow.
So it clearly hit a nerve because it involved an insider abusing their privileges for financial gain, which makes it then fall under the criminal penalty where they can refer to DOJ. And then because of that, it may have been held for that reason. So it could be, they're holding on to it because of those things with the DOJ is possible. It could be simply because they had some sort of agreement not to make the announcement until after the beginning of the year because this is a nonprofit. I don't know. It could be a million things, or it could just be, hey, we're going to hang on to this until all these CPGs come out, because it was signed right around the same time that the cybersecurity concept paper was released. So, we're going to get all of our ducks in a row, and then we're going to announce this when everything's released, because this is very much an issue. It's one of the top 5 hiccup threats. So this is May 2015. So before the audits that were so long ago.
I know.
But here's what happened. In May 2015, the NYPD informed, I don't know, Montefiore. Anyway, Montefiore Medical Center in New York City that there was evidence that a theft of specific patients' medical information was being released. And then at that point, after they were told, they did an investigation and they were like, oh my word.
Yeah.
Yeah. 2 years prior, one of their employees had stolen the PHI of 12,517 patients and sold the information to an identity theft ring.
Oh my goodness.
And people don't get it. It's that, all you have to do is have the desire to do it if you have access.
Yeah. Well, we've said before, you don't want the legal authorities knocking on your door telling you that you got a data breach.
Now, that's never good. It's not good when you get notified by someone else, much less law enforcement. And you don't want to realize that you have an employee that was doing this 2 years ago after you're notified by law enforcement. So, I couldn't put it in a worse moment for those people that had to take that. I feel, can you imagine? No, I don't even want to think about how they must have felt, the stress and the, just the intensity of figuring this out once that first person that went, wait, what? What did you say?
Somebody's like, where's that brochure that Ray Ribble left? Can somebody find that right quick?
So, those are not the place that you really want to be. And then, of course, they initiated an investigation. And, and especially back then, they're still finding in investigations now. But back then, it was pretty much you knew you weren't going to have a good security risk analysis. They were few and far between. So, I mean, it's happening now. Back then, it was even worse. I could hope that it wouldn't be that way today. Certainly not with them.
Yeah.
But my concern is their 2-year cap started when they signed it. So,
oh, wow.
Maybe not. I don't know. And I was happy to see, we always go through the corrective action plans, and this one covered basically the same stuff. You need to do a risk analysis after you develop a complete inventory of all of your stuff, all your equipment, where all the data is, how it moves and breathes, all that kind of stuff. And you need to then do a risk management plan to address and mitigate the risk and vulnerabilities that you identify in your risk analysis. Great. And then develop a plan to implement hardware, software, and other procedural mechanisms that record and examine activity in all information systems that contain or use EPHI. See, now there's one that people always argue. Well, we don't have PHI on that, so we don't have to worry about it. It uses it. We don't have PHI on the PCs. They're no big deal. They use it. So, and reviewing and revising, if necessary, written policies and procedures to comply with the HIPAA privacy and security rule. That was different. Because normally it's just the security rule. They don't focus on the privacy rule, but this one did both.
Why they left the breach notification rule out?
Well, the breach notification rule, and that's a good question because I was helping somebody with an investigation after a data breach, and they were basically, the question was, have you trained your workforce on breach notification requirements? Now, first of all, I tell them we have to notify the patients, but it doesn't help to educate employees about all the details other than here's when the clock starts, and we have to notify in writing to patients every time, even if it's one. We have to notify HHS every time, and if it's over 500, we also have to notify the newspaper. That's enough for most people, not just the newspaper. I'm sorry. Newspapers, the local media.
I was going to say.
I was like, wait a minute. What am I saying?
Yeah. I could put it in my local newspaper. Nobody will see it.
Hey, now, I'm from Dahlonega. The Dahlonega Nugget is a hot item. Your local newspapers have some really interesting stuff these days. It's like the only actual newspapers that still exist, But anyway, I have had people that's the only place they published it was in the local hometown newspaper because that's where everybody got their news anyway.
Yeah,
makes sense. But if you get into the details of what has to be in the letter and all of that other stuff, they're just going to glaze over. The people in charge of managing it and the people that are in leadership positions need to understand those kind of things. Yeah, we have to tell them what happened. We have to give them advice. We have to decide if we're going to offer credit monitoring, which in this case they probably should have because they already knew an identity theft ring at it. But that's not a required element. And, it's around and round we go. But that was our whole discussion of, do we have to educate everybody on every little detail? And I'm like, I'm willing to make that argument that it would not do me any good to tell them any more than what we're already telling them. We tell them it exists and the general rules. So you get into those kind of deep training, and then the HIPAA policies and procedure training. I don't want to have employees read the policy on doing a security risk analysis and a risk management plan. Let's don't waste time. Let's be realistic. So I'm willing to make that argument anytime. But, anyway, it's a 2-year cap, has all the stuff we normally see. And, the clock started in November with, you got 90 days to do this, 60 days to do this, 90 annual reports, and this and this and this. So, great fun. Now, that's not the big message here. The big message here is what was in the message, where we always say, oh, let's see what the point they're trying to make is, because basically what they're trying to say is things are changing. We're going to look at this differently because they're under a bunch of pressure to do that. You got the senators who are on the side saying, why aren't you enforcing this better? We have these rules in place. Why aren't you enforcing it better? You have patients screaming, why don't we do something? How are they allowed to do this with no repercussions? And trust me, I know there's not a worse feeling than having some level of personal violation happen like this and then no consequences for anybody. It's awful. So that leads us into, not only do we have a quote from the OCR director, we also have a quote from the HHS DepSec, who is focused on cybersecurity. So hit us with them, David.
All right. So the OCR director, she says, unfortunately, we're living in a time where cyber attacks from malicious insiders are not uncommon. No, now more than ever, the risk to patients' protected health information cannot be overlooked and must be addressed swiftly and diligently. This investigation and settlement with Montefiore, however you say it, is an example of how the healthcare sector can be severely targeted by cyber criminals and thieves, even within their own walls. Cyber attacks do not discriminate based on organizational size or stature, and it's incumbent that our healthcare system follow the law to protect patient records. That is what she said.
That's what she said.
Yep. And then Andrea, she says, cyber attacks that are carried out by insiders are one of the many ways that can lead to a security breach, leaving patients vulnerable. Our priority is, and always has been, improving the quality of healthcare patients receive. Part of this healthcare is establishing a trust that medical records will not be exposed. HHS will continue to remind healthcare systems of their responsibility as providers, which is to have policies and procedures in place to keep patients' medical information secure.
So it's not just policies and procedures in place, but actually following them. That part should have been in there.
Yeah. As I was reading that, I was like, yeah, okay, a little bit more than that maybe, but I get the spirit of what you're saying.
Yeah, and that's what it's all about. And then the announcement goes on to add that this is just the latest step in the department-wide cybersecurity strategy for the healthcare sector, and points out that just last week, before we announced this, we had released the CPGs, and then they have a big finale. OCR's breach reports, so this is 500 or more, I guess, because this is not clear. It just says the large breaches in 2023. Okay. Over 134 million individuals. Ow. Now,
that's a lot.
Yeah, and 55 million in 2002. So look at 2002. 2022.
You just had your numbers mixed up a little bit, but
yeah, I added an extra zero in there. 2022, 55 million. 2023, 134 million. And you wonder why they're under pressure to do more enforcement. No, you don't. OCR recommends that healthcare providers, health plans, clearinghouses, and business associates that are covered by HIPAA must implement safeguards to mitigate or prevent cyber threats.
What does that include, Donna?
What does it include, David? I think it's things that we've mentioned before, but I thought it was interesting that, usually when you have it in a certain order, the order it's in implies something, even though it's not numbered, it's just bulleted.
Mhm.
It's not random order is the way I look at it, And the first one, reviewing all vendor and contractor relationships to ensure business associate agreements are in place as appropriate and address breach/security incident reporting obligations.
There's you a task to do.
What's funny, it's not funny. When we're doing our assessments, we say, give me a list of all your vendors and then give me a list of your business associates. Have you gone through? Well, we only need to give you the business associates. What does that say, David?
All vendors and contractor relationships to ensure business social agreements are in place as appropriate. So how do you know unless you see all of them?
Mm-hmm. And it's like, well, you don't need to see them all. Well, then how do I know that you looked at them all?
Yeah. You can't review all unless you review all.
Mm-hmm. At least show me that you have a list and you reviewed them and identified them. But if you can't even give me a list of all the vendors at all, then I'm not certain that you could prove you have looked at them all. Or at least it would make me uncomfortable saying, yes, I'm sure you've done it, which is what an assessment's all about.
Yeah. And, honestly, if you're going through an assessment through Cardin, if that's making you nervous, that should be a sign. Because, you're just there to help. It's not like you're going to enforce anything. If that makes you nervous, then Lord, if OCR steps in there, you're going to have a heart attack.
Well, and it's just, again, it gets back to taking it out on us because we ask these questions. We ask these questions because it's what you're supposed to do, and it gets back to, you're just making me do more work and I'm paying you.
Who would say that?
Well, that's always, can't you just do this yourself? You have to tell me what is there. And can't you just write our policies and procedures without doing an assessment? No, I don't know what you have. And this requires depth. Well, just do it so we can put it on the in the book and put it on the shelf. No.
Yeah.
You need
there's this little word. Yeah. There's this little word called liability that I have to take on, and I'm not doing it.
Yeah, no way. So that being number one, I thought was quite interesting because number two is what we thought I would expect to see as the first one, which is integrating risk analysis and risk management into business processes. What? In the boot camp, we go through a whole thing showing you how you do risk analysis all the time, every day, constantly. And you just need to do it automatically with your cybersecurity and privacy controls the same way. But it says also ensuring they are conducted regularly, especially when new technologies and business operations are planned, ensuring audit controls are in place to record and examine information system activity. So, it goes back to, I don't know, I send a report every month and I'm scoring an F on it, but no one's paid attention for months. But everybody, the service provider has sent the report. They didn't notice it. They didn't look at it. They didn't do anything with it. And I received the report. I'm clearly not looking at it if I got 2 or 3 months where it's screaming at me that I got a problem. And then you have people get angry when they do notice that no one's looking. I remember one time having to tell a CEO, he's like, I need to understand why this is happening. I'm sure, it has, this is back when I was doing software. I'm sure it has, it's the program and blah, blah, blah. And I'm like, the program had been alerting your staff for 6 months and y'all were filing it. And he goes, that's impressive. That's impressive. Which takes us to the interesting segue where it goes from ensuring audit controls are in place to record and examine information system activity. The very next bullet, implementing regular reviews of information system activity. Yes.
Yeah, that's the harder one, especially on the smaller organizations.
Yeah. I mean, how are you going to do it?
Yeah. I mean, it's still a challenge to figure out, honestly.
Mm-hmm. Well, we've got to find ways that we can have lower cost SIMs is really it. Just to feed in a couple, the big ones, you're feeding in so many different logs. I get it. They have to have processing power. They have to have a lot of things. But I'm seeing some coming out that are cloud-based that will let them connect and get a good bit of it and do a better job than just the alerts that we are getting today, because it's not doing a deeper dive.
Yeah. I know when you're already kind of strapped for money and you're looking at, okay, I need to put protections in place, and then you have something like a SIM, whereas a SIM doesn't necessarily protect you. Like it's just collecting logs. Now it is protecting you in that it's looking for some anomalies and things like that, but it's not stopping anything. It's more like an alarm system.
Yeah.
It's hard when you're looking at, oh, this is going to cost $300, $400, $500 a month, maybe more. It's like, wow, if I'm going to throw that kind of money at something, I want it to be something that's going to actively protect me, not just throw bells and whistles.
Yeah. Yeah. But we don't have that.
No.
Our hope is AI could do some of it. And, we're getting more and more of that. But how much is that going to cost?
Yeah. Well, the problem just is at least in my experience, the problem is just the disparate systems all over the place. Like I've got different systems and they all produce logs and some of them are being monitored and looked at and things like that, but not everything, not all logs everywhere. They're just not.
Well, and to assume that the SIM has it all because the EHR logs aren't going in there.
Right.
And that's where the data is.
Yep. So I don't know. I don't have an answer for the information system activity because it just highly depends on how granular you want to be. Because you can grab every single device, every single piece of software. It could be a lot.
Yeah. And that when we look at, you can get to such a granular thing that all you're doing is, following up on all these alerts that it's not effectively protecting you in any way. It's just an anomaly. And it's like the people who Microsoft is calling to provide support.
Mm-hmm.
And they talk you through going in and looking at Event Viewer. So you're actually looking at Windows logs and it freaks people out.
Yeah.
They're like, oh my God, these are errors. And none of them mean anything. And that's a core problem there too, is the level of detail of the logging is overwhelming to many systems.
Mm-hmm.
It's a quandary, but it gets back to that whole thing of the software should prevent this in the beginning. It shouldn't be on the user's list of things to know, how to do. But on the flip side of that, you have to know that you need to take your car in to get it maintained, and you have to know the rules to drive the car, or things are not going to go well for somebody. Anyway, on we go. Utilizing MFA to ensure only authorized users are accessing protected health information. I think we talked about that ad nauseum.
Yeah.
With John. I mean, MFA is the thing. The next one is the one that still bothers me. Encrypting PHI to guard against unauthorized access.
When I see stuff like that, I'm like, I don't know that they understand how encryption works.
Yeah. And we talk about it all the time. Storing it unencrypted is one thing. But once I'm using it and you steal it from me while I'm using it, it is decrypted unless we start encrypting individual fields and it decrypts them just when I open them and then, re-encrypts them. So if I don't have that actual record open, it's encrypted.
Yeah.
But now you're looking at the overhead on the systems that have to manage that.
Mm-hmm.
And how many security features can get screwed up there where I lose the data? Or, it's a million things. So there's, yeah. Where was I? What's next, David? I've lost my place in the list.
Second to the last, incorporating lessons learned from previous incidents into the overall security management process. Well, I got one better than that for you. How about incorporating lessons learned on the podcast?
From others.
From others. And then put that into your process.
Yeah. That's what we do with our risk analysis. Whenever something happens to people, we're like, okay, we're going to put this here so we'll remember to tell you it's a possibility that the toilets can explode. And it's, that you can have problems with, if you're in an office building, you're dealing with whatever's happening above you and below you, depending on what those people are doing, it can impact you. And, so it's a much bigger picture. And yes, we cover a lot of weirdness here. And it's one of the things that we talk about even in, our club hangouts is anything weird, we bring it up and we talk about. Let me tell you what happened. And, we're working on one where you hear a couple of real world, let me tell you what happened. And then the last thing, providing training specific to organization and job responsibilities and on a regular basis, and reinforcing workforce members' critical role in protecting privacy and security. Everybody's on the cybersecurity team.
That's what the rap song says.
No. Ooh, now's a good time to insert rap song here.
Help me with hip hop. Let's get it right. Protect your patients. Day and night. Donna and David, the experts on your side. Help me with hip hop. Let's get it right.
Okay. Close it out.
Alrighty. That is our show for today, folks. Thanks for listening. Be sure to share this out to your friends and family, or even people you don't like. We don't care. Leave us a review. We appreciate those. And for Don and myself, remember the HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.